Hi, we're Tony and Gemma, and we're parents to Noah and Freddie Hart, 7-year-old identical twins. Noah and Freddie were born at 33 weeks gestation, making them 7 weeks premature, which isn't particularly unusual for twins.
Initially, the pregnancy went smoothly, despite being classed as high risk and carrying identical twins. However, at around 27 weeks pregnant, I started losing fluid around the boys, but gradually it corrected itself. Nonetheless, to be safe, I was given the steroid injections to help with the boys' lungs, should they arrive early. The boys arrived safely following an 18-hour labour and were immediately transferred to the special baby care unit and placed in their incubators. They were given a little help with their breathing for a few days, and after 4 weeks, we were all allowed home.
And once home, everything seemed perfect for the first 7 to 8 months, until a family day out to the Sea Life Centre, when we noticed Noah was struggling to breathe. By the end of the evening, he was placed in the high dependency unit, and 2 days later, Freddie followed with the same symptoms. For the next 3 to 4 months, we were in and out of hospital with the boys, fighting pneumonia, chest infections, overinflated lungs, and collapsed lungs. Just bad luck was what we were told over and over again. When the boys were 18 months old, Noah had his first seizure, which landed him in hospital for a few days. We were told after some testing that there was no obvious cause of the seizure, hopefully it was just a one-off. After that, Noah continued to have seizures every 2 to 3 months, and he was subsequently started on anti-epileptic drugs to help control them. By now we're into our second winter with the boys, and with it came the same pattern as the previous year: chest infections, pneumonia and collapsed lungs. This time the boys were requiring a more aggressive approach to helping with their breathing, and they had the help of CPAP and BiPAP machines.
By the time the boys were approximately 2.5 years old, Noah underwent an MRI of his brain to help determine the cause of his seizures, and in August 2011 he was diagnosed with Periventricular Nodular Heterotopia. I personally remember that day vividly. I remember crying on the phone to my mum, asking her what I'd done wrong whilst carrying them, to cause so much to not be right with the boys. I thought that I'd caused not just the PVNH, but also their lung problems. Was it because I'd shovelled snow a few weeks prior to giving birth, when Tony had asked me to wait until he got home from work? Or was it because I enjoyed rough and tumble play with my niece whilst heavily pregnant?
This is when Elaine came into our lives and filled us with knowledge and support, and also put us in touch with other families, not only in the UK, but worldwide. The hospital sent off our blood samples to New Zealand to Professor Stephen Robertson for genetic testing. It was here that we would start our journey into finding the cause of the boys' ill health.
By the third winter, on one of our many admissions to hospital, Noah ended up in intensive care and was ventilated, and whilst he was there, tests were undertaken, resulting in a diagnosis of bronchomalacia and non-cystic fibrosis bronchiectasis of the lungs. Freddie at the same time was in a different hospital fighting off another chest infection in their high dependency unit. Although the boys by now were having fewer admissions to hospital, the times they seemed far more serious, and it was taking longer for the boys to recover.
In 2012, when Noah was in hospital for his lungs, Freddie was also admitted, only this time with gastrointestinal problems, and was swiftly moved to a more specialist hospital. Following surgery, he was diagnosed with sepsis ileus, but no cause or physical blockage was found. The boys had always had constipation issues from birth, but again we were told that this could be quite common in children, and that hopefully they'd grow out of it. However, the issues gradually got worse, and their tummy distensions and abdominal pain increased. In the meantime, Noah had also been diagnosed with mitral and tricuspid valve regurgitation and prolapse of the heart, and had been started on medication to help with his breathlessness. After exhausting all other options with Noah over his gastrointestinal problems, he was operated on, a colostomy was formed, and they removed part of his large bowel. This was when he was then diagnosed with intestinal pseudo-obstruction.
After 11 months of ups and downs with the new stoma and continuing pain, we decided the best option was to remove the rest of the large bowel completely and form a permanent ileostomy. Freddie's bowel was rapidly deteriorating also, so the decision was taken to remove his large bowel entirely and form an ileostomy. Freddie, however, had a few added complications. He was required to also have a duodenomostomy, and the lad's procedure was performed to help with the malrotation of the bowel, a separate condition both boys had also been born with. Freddie went on to have several further operations on his bowel. One was to have his stoma stitched internally to his stomach lining to prevent further prolapses. a second to replace the stitches with permanent ones, and then a third operation when he grew scar tissue internally, causing his bowel to twist, which left him in excruciating pain. It was noticed at this point that Freddie's bowels were very floppy, but also that he had trouble with his tissue knitting together internally. After 3 corrective surgeries, his ileostomy has settled down, and at present it's managed well.
We stayed in contact with Professor Robertson over the years, updating him on the diagnoses that were coming in thick and fast for the boys. He was also able to update us on his progress in searching for a diagnosis. Despite the original Filament A testing coming back negative, Professor Robertson felt the boys were ticking all the boxes to suggest a Filament A mutation. He suggested a skin biopsy be sent to him, and this would help towards his investigations. Freddie was given an MRI in 2013, which confirmed he too had PVNH, and more recently he underwent ECGs and echoes to confirm he also has the same heart condition as Noah. It was October 2011 when we started our DNA journey, and on the 17th of July 2015 we were finally given the answer we'd been waiting for. The boys were confirmed as having a mutation of the Filament A gene. The mutation was buried deep in a part of the gene not usually screened for in conventional testing. Professor Robertson had only found it because he was able to use the information obtained from the cells that were sent from the UK from Freddie's skin biopsy. We were told that the mutation was leaky, meaning there was still 10% function left in the gene. If there had been none, then the boys would not be here with us today.
Getting that email was something that I felt I needed, a reason behind the boys' bad health. I needed to know what was causing everything. We knew that it wouldn't change anything for the boys. It wouldn't cure them. It wouldn't change their treatment or medications. But it did give us an explanation, and sometimes that's enough. We had come so far with Noah and Freddie and been asked so many times by medical professionals what was the overall condition of the boys, and finally we were able to give them an answer. It was a huge breakthrough for us, and we can't thank Professor Robertson enough for not giving up on us after 5 years.
Noah and Freddie have an extensive team of specialists overseeing their care. Over the years they've had input from neurologists, cardiologists, gastroenterologists, epilepsy nurses, community nurses, occupational therapists, physios, respiratory specialists, endocrine teams, geneticists, surgeons, ENT specialists, respite nurses, dietitians, psychologists and child mental health experts, to name some. They've undergone several operations either to fit gastrostomy buttons, remove tonsils causing sleep apnea, they've had colostomies and ileostomies formed, they've had complications from surgery, appendix removed, LADS procedures performed, gastrojejunostomy inserted and a laparotomy carried out. Being a child with complex medical needs is very testing.
Living with complex medical needs is difficult. Living with rare conditions makes it even more challenging. The boys are still boys and need to be treated as such. Sometimes it feels like they're treated as patients and not children. They still like to play and have fun. We just have to be a little more conscious of situations. We don't want pity, but we understand that to the outside world who hasn't experienced what we do every day, it can come as a shock to hear what the boys have to go through and put up with. We have our moments when we think when times are tough, but most of the time we're trying to make the most and the best of things.
Trying to stay positive can be difficult. We don't take things for granted, but we can still be caught off guard, and those times can be the hardest. We're a close family, and working together as a team is essential for us. Stopping and thinking about what could happen in the future won't help us, but staying positive and strong for the boys will. They have such a lust for life, they're a credit to themselves. They don't complain, they just pick themselves up and get on with life. We've learnt from the boys they like to keep us on our toes. They can go from being on great form to being very poorly very quickly. Some nights we go with little sleep, and some days we feel like we've got the weight of the world on our shoulders, making decisions we never thought we would have to as parents. We know that at any point we may have to change plans, and that's just how it goes when living with complex medical needs. The flip side of this is that we see each day as a gift, and we do our best to make the most of every day.
We have so many hopes and dreams for the boys. They may not have been our original ones, but before we knew our children would be diagnosed with a rare genetic neurological condition affecting many other areas of their body, but they are just as important and real to us. I remember when I was pregnant and filling out my baby book, in the wish section, I wrote, "I just want the boys to be healthy." We didn't care if they were boys or girls, what colour hair or eyes they had, just that they'd be healthy. We often say if we could just go a year without an admission or a new diagnosis, then it would be a miracle. It would be nice to not have to fight the National Health Service or school sometimes in order to get the best for the boys. Sometimes it feels like we are educating everyone else. PVNH is still rare, meaning not everyone has heard of it. Not all doctors and consultants sing from the same hymn sheet. Trying to organise teams to communicate with one another can be near impossible. Sometimes it's easier for them to just treat their area of expertise rather than all working as a team. You find yourself repeating the same history time after time.
We do feel lucky though. We have two beautiful, brave, courageous boys with such great personalities. They are happy-go-lucky and they don't see any limitations to their conditions. They try anything they can and don't let things get in their way. We have an amazing support group of family and friends, and they don't judge us, they just support us all the way. We've met many other incredible families like ours on our journey, and we all support one another. We wouldn't change Noah and Freddie for the world, and we're all in this together. Thank you.